Hi, and welcome to this educational video on Introduction to Receiving. In this video, you will learn about the receiving process, which includes package inspections, dock logging, confirmation of items and quantities received, staging receipts, and storage of packing slips. This video is presented by Trident Ed's Consulting, where it is our mission to provide thoughtful instruction, tips, and guidance on healthcare supply chain topics to passionate supply chain professionals just like you. Receiving is an essential role for inventory management and the entire procure-to-pay process. The purpose of receiving is to accurately document what was received, provide adequate handling for all receipts, and capture proof of delivery. The receiving process should answer several questions. Did the vendor ship what was on the packing slip? How does the shipment compare to the purchase order? Is anything damaged or missing? Does this receipt require special handling? For example, is refrigeration required? Is this something that should be delivered quickly? The remaining slides in this course are intended to provide an overview of how receiving typically works in a hospital or other clinical location that has receiving dock. Even though all hospitals have a dedicated receiving operation and a receiving dock, it can be challenging to manage the high volume of packages that come into a hospital each day. To reduce the workload of the receiving team, most organizations establish policies to enhance the success of the receiving operation. Some common policies that the hospitals often implement to improve and support the receiving operation include requiring a PO number for all medical, surgical, and lab products. Similarly, some hospitals have an even more stringent policy where all packages require a PO number. These type of policies ensure that the receiving staff can efficiently determine what was ordered and where to deliver goods that arrive. All goods related to POs must be delivered to the receiving dock. This means that suppliers cannot deliver direct to the department that ordered the goods. This type of policy creates an environment where receipts can be effectively managed versus trying to track down receipts after an invoice arrives. We have found that organizations that establish and enforce these type of policies are rewarded with improved delivery times, decreased labor requirements in the receiving area, lower invoicing issues, and a better image of the department. For most organizations, the receiving process begins when a delivery vehicle arrives at a healthcare facility and is unloaded. That said, it is worth noting that some large hospitals in urban locations have an inbound delivery management process to control the timing, sequencing, and metering of trucks arriving and departing their receiving docks. Since this type of process is not common, it is not covered in the course beyond this brief call out. Once a delivery vehicle has arrived and unloaded the packages addressed to your location, the hospital receiving staff should inspect the packages to verify the address and look for noticeable damage or soiling. If the inspection is successful, they will sign a mobile device or paper bill of lading to accept the delivery. Before signing, the hospital receiving staff should verify the package count matches the physical number of packages that are being delivered. If a package is noticeably damaged, most hospitals will have the receiving team refuse to accept the package. Other organizations will accept the package and then work with the vendor to return the damaged goods. Check with your supervisor to determine how your organization operates. Packages are then staged according to local processes. Before moving items around, receiving staff will assess package labeling and package type to ensure they understand any necessary special handling requirements. For example, bone and tissues are typically received into a tissue tracking software application to support the requirements related to these special products. Refrigerated products and products delivered via overnight courier are typically expedited to the requesting department, and inventory products are typically staged at a special location to ensure these products efficiently make it into the storeroom. Depending on the size of the healthcare facility, the process of managing income packages may be an all-day activity or it may be limited to certain hours of operation. It is worth noting that many organizations perform a dock logging step. either just prior to signing for the packages or just following that step. So, what is doc logging? Doc logging is a receiving process whereby packages and their tracking numbers are entered into a log. This is typically accomplished by scanning existing package barcodes using a mobile device and storing this information in the inventory management or package tracking software application. This information is invaluable to the supply chain and accounts payable teams when it comes to researching lost packages and proof of delivery notices from suppliers. There are some complications with this type of process. For example, express carriers such as FedEx and UPS are often in a hurry to depart and apply pressure to the receiving staff to sign for the packages before dock logging. There can be several couriers and truckers looking for attention at the same time. Like the above situation, this will apply pressure to the receiving team to hurry along. Not all package barcodes are able to be scanned with the local scanning equipment, and not all packages have barcodes. For these reasons, the receiving team may have to print and apply system generated labels to some packages before they can complete the dock logging step. If your organization uses a dock logging process, strive to comply with the established processes because the information that's being collected is vitally useful when a product is lost, misplaced, or when a department is simply unsure as to whether the product's made it to their department. As mentioned earlier in this course, receiving staff should perform a cursory package inspection before signing for packages. Even so, additional inspections are typically performed after the delivery driver has departed from the area. To facilitate this, most receiving teams will stage packages to facilitate the follow on steps. Higher priority packages will be managed first. When there is damage, the receiving team will decide whether to deliver or return the package. In some situations, they will ask the department that ordered the product to visit the receiving dock to assess the situation and determine whether they can accept the product despite visual package damage or product damage. Once the package inspection is complete, the receiving staff will confirm which items and quantities are contained in each package. This is typically a three-way comparison that includes the packing slip, the physical products, and the list of PO items that have not yet been received. The physical items delivered will be compared with the packing slip. The packing slip will then be compared with the purchase order in the ERP or Materials Management Information System. It is not uncommon for a packing slip to incorrectly state the quantity of items sent. For example, a packing slip could indicate that 5 boxes of syringes were sent, but only 4 were physically sent. The receiving team must accurately identify these types of discrepancies and record enough information in the ERP MMIS system and on the packing slip to empower buyers and accounts payable staff to defend the receipt transaction when working with suppliers on invoice discrepancies. Confirming the physical counts of items that are delivered may seem like a daunting task, but this action prevents downstream issues such as inventory levels from being incorrect and errors with invoice matching, and ultimately delays in supplier payment. It should be noted that if product damage or any other unacceptable condition is discovered, the receiving staff will initiate a vendor return. The receiving team should have a designated area for receiving. This is an area where receivers can inspect packages, confirm quantities of items received, receive items into the inventory management system, and stage for delivery. Typically, once an item is received into the ERP MMIS system, a delivery ticket will print out. The receiving team should attach the delivery ticket to the applicable products and stage for delivery in accordance with local procedures. Following the staging of receipts, the PO will be delivered to the department. Alternatively, damaged and incorrect products will be returned to vendor. We will cover the delivery process, known as distribution, and the return to vendor process in separate courses. It is important to store packing slips for all goods that come through the receiving area, as they may need to be referenced in the future. For example, there may be an invoice discrepancy or a complaint of lost items from the requesting department, both of which would benefit from an inspection of the packing slip. including any notes that were captured during the receipt and delivery processes. Most organizations store the paper packing slips in a filing cabinet. While this isn't an efficient method for storing the paper, this can be a cumbersome amount of paper to sift through when a discrepancy is being researched. As a result, some organizations have invested in electronic document storage solutions that allow hospital staff to scan the packing slips into an electronic format and save them in a location that is accessible by all key stakeholders. This solution requires more effort at the front end, but makes the retrieval process less burdensome. This approach also empowers buyers, accounts payable staff, and others to directly retrieve packing slips when researching an issue. Even so, this sort of electronic solution will only work if the hospital accurately records key data elements such as PO number when saving these documents. Thank you for watching all the way to the end. I hope you enjoyed this video and picked up some valuable information from this video introduction to receiving. If you enjoyed today's video, please like and subscribe so that we know that you specifically would like to see more of this type of content.